and welcome to this podcast. My name is Carrie Hyde, and I'm your host and your pet's life coach. Today, I'm going to be speaking about quite a few subjects, but we're going to really dive into some vaccination issues that our pets are facing, both our dogs and cats. And so we've talked about vaccinations on the show before, but now we're going to get a little bit deeper and really, I'm still seeing the reason why I wanted to do this show again with another veterinarian is because I'm still seeing dogs and cats being just bombarded with vaccinations. And so we want to kind of really help you as listeners understand why people like me and people like our next guest are adamant about getting this education out to you, because it really is affecting your pets. So if you have a dog or a cat, which you probably do if you're listening to this, or if you're a veterinarian, I really encourage you to listen to this whole episode, because we're going to get pretty deep in it. So I'm so excited to bring on our next guest, who I met through Joey's Legacy. As most of you know, I work really closely with Joey's Legacy, which is an organization to help change the laws about how our pets are seen within the legal system, and changing them from being just property to actually being companion animals. And so when I meet veterinarians through there, I already know. I don't need to do much research. I already know for a veterinarian to come up and say, hey, we've got a problem, it shows a huge amount of integrity for me, which is what I like to bring on the show. So I want to introduce you to Dr. Michael Dym. Dr. Dym, hi, good morning.
Hi, nice to be here, Carrie.
Yeah,
very nice.
I'm so excited to introduce you to our listeners, and we have listeners all over the country, and I think they're going to be very excited to listen to what you have to say. Before we jump right into it, I know our listeners always like to know a little bit about how I always like to know, and I know this sounds kind of crazy, but have you, when you were a little boy, I could take you back to when you were a little boy, were you, because I always visualize, me when I was a little girl, I knew there was something in me that I needed to be with animals. I was always rescuing them and, that kind of thing. So did you have a similar, is that just?
I did. I was more of a introverted loner type child, and still like that a lot today, the older child, that is. But, I think as a younger boy who was kind of shy and introverted, didn't have a lot of friends, our animals, when we had our animals in our family home, they really provided that unconditional love that really every child, every human being really throughout life is looking for.
Right.
So, being more of an introvert and being more quiet and shy, I gravitated towards animals because they really did give us the love and TLC that sometimes we don't get from our own families.
Right.
And I think right from the very start, I was drawn to, affection to animals and helping animals and, learning about them in school through the various stages and right on up through high school and in my work as an animal science major at Cornell, and then eventually, along to University of Pennsylvania, where I my veterinary degree.
Wow. When you say often we don't get from our own families, it almost makes me want to tear up, but it's true. I mean, sometimes,
right.
Even sometimes our seniors, they live alone and they only have one animal or two animals to love them. And the reason I bring up about when veterinarians are younger is because a lot of times when I speak with veterinarians about how they got so far off the path, I always encourage them to think back to when they were a little girl or a little boy, and because I think sometimes veterinarians get off that path of why they
Yes.
wanted to do this, and then they get inundated with business stuff and what veterinarian school taught them to do, and sales and all that stuff. So I always encourage veterinarians to just remember when you were a little kid, your first animal, because I think it helps kind of guide us a little bit. So that's why I always
just sometimes have a seat in the waiting room of the clinic that you might be working at and just sit back and be an observer and watch the animals as they walk in, and then you realize, wow, instead of being busy, who's my next patient? What do I got to do next? What surgery? What this? What that? You just sit down and you just take it all in. That's why I'm here, to help these animals.
Yeah, and it's so,
as an observer.
That's why I knew you're so perfect for the show, because you're able to sit back and just take it all in, because people forget. And I think that's when mistakes happen. I think that's why we have Joey's Legacy, which you and I are both very involved in. It's sad that we have to have this organization. So you went to Cornell University. That's amazing.
Right. I had a wonderful education up there.
Yeah.
as an animal science major in the agricultural school. Studied real hard and didn't play as much hard, but it had its payoffs the other way. And then decided to go to veterinary school in Philadelphia. Yeah.
So Cornell is not a holistic veterinarian school. How did
No.
you, and we know, well, I'm going to tell you right now, Dr. Dym is a homeopathic holistic veterinarian, correct?
Yes. Good
So,
description.
and Cornell didn't teach you that. So what happens? Where
No.
do you graduate? Start from there when you graduate, how you got to where you.
Well, after Cornell, where I got my background in animal sciences, I took a year off, and then I ended up going to traditional veterinary school, as I said, in Philadelphia. And that's when you learn about the diseases and the pathologies and the body systems. And we're basically taught, when we get to our fourth year of veterinary school, how to either fix with surgery what's in front of us, or how to make symptoms go away with drugs or medications, or vaccines. And what I quickly learned after being out of school, I graduated in 1991. And what I quickly learned when I got out of school was that that all of these wonderful skills I learned at Cornell and Penn on how to look at a patient and how to work it up and how to do the tests and how to choose the drugs and memorize the drugs and do the surgical procedures, how these animals were not living longer, healthier lives. They were either, they might have gotten quick short-term relief, but they were coming back to the clinic with the same problems. They often would get worse with time and then get sicker on a deeper level as that illness or imbalance, as we say in holistic medicine, goes deeper. And then these were the animals we see that come in with premature liver failure or kidney failure or cancers. And when I saw that, Gary, I said, there's got to be something that we missed out on in our traditional school training. And that's when I sought out to learn other modalities of medicine.
Every single holistic veterinarian that I speak to always says that that's what ended up happening. They realized that pets were just being quickly run through and treated quickly. And it takes a very special person to recognize something's not working and something's kind of off.
Right.
So when you were working in traditional veterinarian hospitals, did you have a mentor, somebody that said, hey, we could do this, or was it something you kind of sought out on your own?
Well, I kind of sorted out on my own. I always thought about, why an animal presented. So, for example, animals with ear infections, a very common one, obviously. I was always a student and a young veterinarian that said, well, rather than just sticking antibiotic and antifungal drops down the ear canals to kill yeast and bacteria, we should be asking why they're getting these problems, even from a Western medical model. And so many young veterinarians don't. They just hand out the tube of ointment or ear wash and they get better and then it comes back. And so I was always one who questioned why. And of course, when I learned that the why from the traditional model of medicine was still not deep enough for my liking, in other words, looking at it as just allergies to airborne allergens or food components, I wanted to go deeper than that. And that's what led me to my study of energy medicine and in particular homeopathy,
Yeah.
to go deeper. But you're right. The truth is that we basically are taught to treat the body as a car. And when the part breaks, you put the right, lubricant in or the right medicine in, or you do a surgical repair, and then we put the car back on the road and it drives. And that's not how the body works in health and disease. It works as a whole, and it works with an underlying energy that governs everything. In Chinese medicine, we call that the qi. It flows through meridians. And in homeopathy, we call it the life force or the vital force. And that governs the function of the whole body. So when one part of the body is not working well, the whole body's not working well because it works as a whole.
Yeah.
And that's what my understanding came to very quickly. Once I saw that when I would fix one part, Harry, the problem would just go somewhere else. I'm sure you've seen these cases, right? Comes in for this, you treat this with Western medicine, it goes away or it's suppressed. And then all of a sudden the animal has a deeper issue. Now it has digestive issues,
Yeah.
or it has diarrhea or vomiting or other problems. It's all related. It's not separate.
I think that's the hardest thing for pet parents and conventional veterinarians to understand is that it's all related. They treat it
All related.
so individualized, compartmentalized. That's why it doesn't get any better. And it's interesting that you bring up ear infections, because I think that every veterinarian that I have had these conversations with, we go back to those ear infections. I think it's the first thing that, and it was for me. So I worked for I think our listeners are going to be very sad to hear this, but ear infections, pets would come in, same ear infection over and over and over, different antibiotic. Now he's got diarrhea. It would get to the point where the conventional veterinarians didn't know what to do, so they would sew up the ear canal.
Right.
I mean, now, I mean, that, how drastic is that? And some of these animals were just in so much pain for so long, and then they would just permanently sew up those ear canals.
Right. Because what happens is the ear canal becomes so scarred from all those infections, and the opening just there's nothing there. So they basically obliterate or ablate the ear canal. That's what the procedure is called, the ear canal ablation.
Yeah,
it's barbaric.
And it is. It's absolutely, that's the perfect word. It's barbaric, and it was done, and it's still done to this day. I don't see it as often, but I mean, we used to see it all the time. Cocker spaniels.
I was just going to say Cocker spaniels.
Yeah, Cocker spaniels were the number one. Sew up the ear canal and be done with it. It was just horrible. I sat through some.
And that's a great example of looking at it as that part being broken.
Yeah.
And Western medicine, just looking at the part, not looking at the whole animal, where the food might be involved, where other immune components might be involved, where toxicity might be involved, and not looking at it as the whole body being out of balance. And those ear discharges, what we say in homeopathy, they represent the body trying to discharge to the outside things going on the inside, so that when we come in and we shut off that discharge, then all that imbalance deep in the body is just going to get worse. It's almost like when you're driving your car along and the engine light goes on, you're going to pay attention to the engine light, or you could punch the engine light out and just keep driving. Still, the car's going to drive for a while, right?
Yeah.
And then it's going to stop.
Well, that's a really great analogy, honestly, because that's what I hope for our listeners, is to stop treating their pets not just legally as property, but also medically. They're not a car. There's so much more complexity going on, and we have to seek out these veterinarians that understand the complexity. Otherwise, you just go down that path of just horrible, it never ends, and you have a sick animal their whole life. I mean, how many
whole life.
Their whole life. So I'm glad that we talked about ear infections, because we can go all the way back to our puppy. Let's kind of give an analogy of a puppy that can be set up for success. I always say you either set up a puppy for success or failure, and it happens at the very first veterinary visit with your puppy. And you really, it's one or the other. And ear infections are one of them. I have dogs that come into me, and I can look at their records, and I already know the path we're going to be on based on that first visit. So we said we were going to talk about vaccinations. And so let's look at what a conventional veterinarian would do on a puppy's first visit. What's the most common thing a puppy would get in the first visit?
Puppy's first visit. We can go right to the earlier source, the health certificate that the puppy gets.
Well, yeah, we could go.
The first veterinarian that gives the exam to the puppy at the breeder to transport it across the state or across the state lines. They're still getting the same things. So that little tiny puppy that's 4 or 5 weeks old, by the time it's at the breeder, they're getting vaccinated with multiple vaccines, not only distemper and parvo and other combination components that are in that vaccine, but also they're getting, could you believe, leptospirosis at that age, bordetella or kennel cough at that age. They're being wormed, not with just one wormer, but 2 or 3 different types of wormers, so that we can really, unfortunately, disrupt the gut flora. They're being applied flea or tick chemicals, either on their backs or a pill that they're given. And that's what's handed to the new guardian to take home and to raise. And that little puppy has been literally poisoned at that young of an age. That's the word I have to use, a stronger word.
Yeah.
And at that young of an age, fortunately, the body has the ability to be detoxified and to be replenished. But if we don't get started with that right away in these young little puppies, even if they don't have any overt symptoms right then and there, if we don't get started, we have set up that puppy for a lifetime, or kitten, of chronic disease. And as you mentioned earlier with the ear infections, a lot of times at these young ages, these puppies will start with those waxy ears and the discharge, and along come the ear mites secondarily. And those are all just secondary pathogens. But the reason why these animals are showing these symptoms are one word: they are toxic, from everything I just stated. So a lot of these young puppies that have these ear inflammations, it's from being poisoned by all those things I just mentioned.
Yeah.
So,
And then they're handed, I'm going to add to it a little bit, poor diet, right? So then
right,
here's your puppy formula, poor diet. Often those puppies will go in. I've seen charts of puppies that have gone in because they had a little bit of diarrhea. And so the veterinarian will give them the vaccines, the flea and tick stuff, the heartworm medication, the metronidazole for the diarrhea, and the flea and tick stuff. And I look at this and think, this is it. You're going to have a really hard time getting this pet back.
absolutely.
And people don't realize it. They think, and I always say this, and it's a hard thing to say, but the most compliant client usually has the sickest pet. So,
Right.
I've had people come to me and kind of go, oh, you're going to hate me because I don't ever go to the veterinarian. And standing in front of me is a very healthy animal who doesn't have ear infections, who doesn't have all of these things. And I kind of say, it's kind of interesting. I mean, I'm not an advocate of not seeing a veterinarian, but sometimes people who aren't going in the conventional veterinarian office every month and getting all of this stuff have very healthy animals, which is not what people should have to not go to the veterinarian to keep their dog healthy or their cat healthy. Which is why I talk to veterinarians like you, because I know that if a puppy came to you or a kitten comes to you, we're going to be thinking about the whole and what each one of those, like dewormers, right? Dewormers are given to animals without even knowing if the animal has worms. It's just an automatic, got a puppy, got a kitten, we're deworming. And
doing it every week too.
Yeah. And what does a dewormer do to the gut?
Well, it not only kills any overgrowth of worms in there, but it kills good bacteria, good flora. It irritates the intestinal lining, causing right away a leaky gut. So that a leaky gut meaning that you're going to get proteins, incomplete digested proteins from the intestinal tract that'll be absorbed across that leaky gut lining. And you're already setting the stages for immune and allergic reactions, not only in the gut, but elsewhere in the body. And that could take the form of ear infections. It could take the form of skin disease and hot spots, chronic bowel issues, airway problems, and respiratory issues. I mean, the gut is the window, as we talk about all the time, the window immune system to the rest of the body and the brain as well, the gut-brain connection.
Oh, yeah.
So, so we really, when we do these things, Carrie, we really are destroying Mother Nature and how they evolved to keep invaders out. There's another cool metaphor I often will use, like, for example, when newborn infants are born, and they literally, for 9 months, right inside the mother's womb, they get everything they need. Everything is all provided for. There's there used to be no vaccines of the mother, but, there's no anything. It's just the babies are being provided for. They come out, these beautiful little bundles of joy from heaven, right? And then what do? As Wayne Dyer used to say, the great, he was an outspoken guy, Wayne Dyer, said, we're going to take over from here. Even though it was done so perfectly inside, we're going to now take over, and our egos are going to manipulate health and, in many cases, destroy health.
Yeah.
And that's what we do when we overtreat these animals at those young ages.
Yeah.
And the vaccines are really the top of the list because, and the food,
right?
The food and the vaccines.
Yeah.
Because you're vaccinating these animals, you're injecting them, which by the way, totally bypasses how the immune system evolved to keep invaders out, not through a needle. Parvovirus doesn't come through a needle into the system. And we do it in an inordinate amount of times at young, this at 3 weeks and 4 weeks and 5 weeks of age. And those are the ages where those vaccines aren't doing any good for those puppies at all because they're binding to the antibodies from the mother's milk that those puppies already have in their systems. So in other words, the purpose of the vaccine is to stimulate the puppy's own immune response. Those early vaccines are not doing that because there are pre-existing antibodies. So you're really just poisoning your puppy when you're getting all these mega vaccines at 2, 3, 4, 5, 6 weeks of age.
So the only reason I really wanted to quickly talk about like deworming and stuff before we get into it, because sometimes people think, okay, fine, then I just don't have to give a vaccine and then my puppy will be healthy. So I wanted to cover dewormers, metronidazoles, all of those things, and then lead into vaccines. But,
sure.
So when we give, when we're talking about vaccinations, and how come there is not a standard? Like there's a difference. Like one veterinarian will say, let's give this. Another veterinarian will give them all. Is there something that I don't know if it would be the AVMA, somebody that says this is the standard that we do, or is it really left up to the veterinarian to do what they want? Other than, I guess, rabies is the only thing that by law veterinarians have to give, right?
Right. Well, ultimately, it always is up to the veterinarian.
Okay.
There are guidelines. They're not considered the laws of veterinary practice, but there are what are called core vaccines, CORE, which are expected to be given to all the dogs. And there are what are called non-core vaccines, which are optional based upon the lifestyle of the animal, whether the animal will be at risk for certain infectious diseases. And then there's obviously the schedule. And so typically, and I believe it's the AVMA, there's other organizations as well that come out, the AHVMA, not the AHVMA, the AHA organization comes out with recommended vaccine protocols. And basically, with the core vaccines, it's a series of starting at 6 to 8 weeks. Again, those early ones really don't do very much.
Real quick, I don't want to cut you off, but what is it, 14 weeks or 16 weeks when?
It used to be 14 weeks.
Yeah.
And now Dr. Schultz, who did a lot of this research, pushed it up to 16 or even 18
Oh, that's
weeks
why I'm hearing both. Okay.
Yeah. You're hearing both because maybe 0.1% of the dog population, 99% have adequate immune responses at 14 weeks, and maybe an extra, you'll catch the other 1%,
right,
where the antibodies will be gone in the bloodstream and they'll be able to respond to the vaccine.
Okay.
Yeah.
Okay. So just to clarify, Dr. Dym is saying is that anything before the 14 week, if we want to just go with 14 weeks, vaccines for the 14 weeks is just putting toxic stuff into your pet and not providing any extra immunity, right? Extra boosters. So you want to be really, really careful with that, which is another reason why I want you to see veterinarians like Dr. Dym, because it's important to understand that. I'm so surprised at how many conventional veterinarians don't know this at all. They have no idea. Just had somebody call me the other day and tell them, we'll get into titers in a minute and I'll explain what it is, but her veterinarian said there are no titers for rabies vaccines. You can't, they don't exist. And that's heartbreaking to me to think if somebody's going to decide whether to be holistic or conventional, you should know both sides before you make that decision, not just not know about it and therefore say it doesn't exist. So,
and say a wrong statement. Sure.
Yeah, it's a really horrible thing to say something doesn't exist just because you don't know about it. So, but let's talk about. So you touched on something I really love to tell my clients about and our listeners about is the differences between core vaccinations and, I guess we could say the non-core and the core, but then there's also required vaccines. And I think people get those very, very confused because their veterinarian says, here's the vaccines you need. And then people read into that meaning that it's required. So can you tell us a little bit about that, the differences?
Well, veterinarians giving their opinion when they say these are required. The only legally required vaccine from a law perspective, as you mentioned, is rabies. Or if you're traveling to an international country, sometimes they do have their own rules on distemper and other vaccines that they want given before the puppies, or titers, the antibody levels before the animals come in. But in general, though, Carrie, anything other than rabies is the veterinarian's opinion on what they feel the required. They're just using the term required or the clients maybe perceiving it as required when it's not really required. It's recommended by this particular
Yeah.
veterinarian. The other thing I wanted to bring up relative to this topic that's very important is it's the more components you put into these animals in one shot or at the same time that also is so damaging to the immune system. So whereas maybe a puppy gets a parvo shot, they usually will respond immunologically to that parvo vaccine. But if you couple that parvo shot with distemper and hepatitis and parainfluenza and coronavirus and all these other components, and a rabies and a bordetella all at the same time, the immune system is overwhelmed.
Right.
So for those that choose to vaccinate, you want to use one or two at most. They're called mono or bivalent vaccines. And those are for those who choose to vaccinate.
Right.
I try to discourage as much vaccination as I can.
We're going to get into that for sure, because I want our listeners to kind of understand, more where you're coming from. But when we talk about those mono vaccines, the problem is that veterinarians are getting really overwhelmed. People are overwhelmed. And so we sell out our animals for convenience. And so veterinarians will say to you, hey, look, they'll even do things like, I don't want to stick your dog more than one time, so I would prefer to do this. I don't want to hurt your pet. And so they kind of, we buy into that and say, yeah, it's convenient. I don't have to keep coming back. My dog or cat may hate coming to the veterinarian. So in our mind, it seems like we're doing the best thing for the animals, but really we're letting convenience provide the health of our animal, and those vaccinations are available. So sometimes veterinarians, I've heard people tell me that their veterinarian said, oh, you can't, they all come that way. I'm like, no.
Right. No, they don't all come. And they all should never be given. An important concept, I don't know if we're going to get into it, but an important concept is they shouldn't be given if Fluffy is coming in for an ear infection.
Oh, thank you.
Or for a bowel problem, or if the animal's getting its teeth cleaned or being spayed or neutered. Yep. Let's not catch him up on his vaccines when he's being spayed or neutered. I mean, when you're in a hospital having an anesthetic procedure done, even in our sick world today, they're still not swooping in and giving flu and COVID-19 shots yet to someone having surgery.
Right.
It's just not done that way.
No.
And that's what we do to these animals.
It's so interesting. That's one of my favorite things to talk about, because I get really passionate and upset about the argument. So I've had people know I've worked for veterinarians pretty much my whole life. And the argument they used to use was, I can't have an animal in my facility that's not up to date on his vaccinations. And so while he's here getting whatever surgical procedure, we're just going to give him this vaccine. What's interesting about that is, and one of the good things about the pandemic that we're all going through, is people are starting to learn how long it takes to build those antibodies. So say that you're risking anybody, you're actually causing more harm if your pet's going in for surgery and getting that vaccine. But that was the argument that every one of those veterinarians would say when a client would say, is that a little much? Like, she's going to get spayed, she's going to get this, she's going to get her shot, maybe we should hold off on the shots. And veterinarians would say, oh no, we need to make sure she's vaccinated before she goes under. But the stress, those animals would end up almost always sick.
Always sick and having reactions.
Yeah.
And then, the term also, when they're under anesthesia, well, the argument is, well, it's convenient and they won't feel it, so they're trying to get it in through that reasoning also.
Exactly.
And it's we have to use our heads.
Yeah.
And think about, is that something we would want for ourselves, for our children? And a lot of common sense goes out the window with the vaccine issue in veterinary medicine.
It does happen in human medicine too, and you do have to be careful. And I'm glad you brought up, think about yourself, because it might help you. I went to, not to get too much off topic, but my doctor was out of the office, and so I had to see a colleague of his. And I wasn't feeling well, didn't know what was wrong with me, thought it might be my thyroid off because I'm old and female. So like maybe that's what it is. But when I went in, he asked me what was going on. I said, I'm just not feeling well. Something's off. And he says, oh, okay, well, we'll run some blood tests. And while you're here, do you want your flu vaccine? My response, which he didn't like, was, can we find out if I'm dying first?
Right,
But
right.
it is happening, and we have to be proactive, not just in our own health, but in our pets' health. But
Right.
so
We have to be the advocate.
you have to, and you have to not be afraid to be the advocate.
Right.
You have to be willing to stand up and say, and if you have a veterinarian who's going to make you feel like you're, bothering them, then you need to find a
Right.
veterinarian, right? Because it's just,
Right. Right.
dangerous to do that. So when we talk about non-core vaccines, for example, so we can talk about Bordetella is a non-core vaccine,
Right.
parainfluenza is non-core, leptospirosis is non-core. What?
Lyme disease.
Lyme disease is non-core. Rattlesnake, which here in Orange County,
Yes.
I'm always amazed when I see these pets getting rattlesnake vaccines that live in condos. But what makes those, how do they define that? Why is this a non-core and this is a core?
Well, because again, they define it based upon what their definition would be lifestyle. So in other words, the core ones would be ones that most of the dog population or cat population would be susceptible to in their minds. And the non-core are going to be for select populations, the ones out in the fields where there's rattlesnakes or ones out where there's deer and deer ticks in Lyme endemic areas where there's standing water and all of that. That's the thinking. So they call it a non-core. So if you have a little Yorkshire Terrier that lives on the 40th floor in New York City and doesn't leave and uses a litter box in the corner of the apartment, he or she is not going to be susceptible to a rattlesnake vaccine or a rattlesnake poisoning. And he or she is not going to be susceptible to Lyme disease or leptospirosis if it's living basically in an apartment. And when it goes out, it stays in a little bag that the owner guardian carries around.
Yeah.
So that's what would be a non-core vaccine, the ones that are based upon lifestyle of the individual animal. But here's the sad part, and I've seen this with my work with Joey's Legacy, as I'm sure you had, is they're giving these non-core vaccines like they're core vaccines.
Yeah.
They're just pumping them all, Bordetella, leptospirosis, Lyme disease, just going right in there. And they don't even think about it, and they're just giving it to these animals.
Yeah.
And that's not good medicine.
Yeah.
Not at all.
So I was doing some research on core and non-core, and I came across some definitions, and one of them also was that they're less effective vaccines, the non-core.
Right. That's true too.
Yeah.
Thank you.
And also something along the line, like there was quite a few of them and written by different people, so they're less effective, and that they don't stay in the body as long. And so Bordetella is a good example, which is why they give it sometimes every 6 months or every year instead of every 3 years. But I just real quickly want to talk a little bit about Bordetella. So because you touched on something that, if your pet's going to be exposed, well, now with all of these fabulous boarding facilities all over the country, I just did a podcast on someone else's podcast. I came on and we did a topic that I entitled. She asked me to title it, and I said, I want to title it, "Is Your Boarding Facility Killing Your Pet?" And I wasn't trying to, I know it's a shock value, but when you're boarding your pet and the boarding facility is requiring this vaccine every 6 months, and then they have these enormous amount of dogs coming out with Bordetella or kennel cough, we wouldn't even know if it's Bordetella. It's troubling to me, because that's what happens is if you go to your veterinarian and say, I board my dog, then the veterinarian will then say, well, then you have to have the Bordetella vaccine. It's something that needs to be talked about, is how effective is that vaccine, and what about the disease? So that's where you come in. I want you to explain, what if an animal gets kennel cough, why is kennel cough called kennel cough, and then we have 2 vaccines for it, Bordetella and parainfluenza, correct?
Right.
So, but why is that? What is it? What symptoms? And
it's a stress-induced disease. It's basically, these are organisms for the most part that are normal in low numbers in the dog's airways. So in other words, if they're not just coming from the outer limits, they actually are normal. There's normal populations of Bordetella in every dog's airway. And under conditions of stress or crowding or new food or anxiety being away from the owner, barking all the time, that's a stress. That's the seeds of why we would come down with a quote unquote infectious disease. But the infection isn't coming from the outer limits, it's coming from within that particular animal.
Wow.
So when we give a Bordetella vaccine, we're actually giving an organism that's already there in low numbers to an animal who's already going to be stressed. And we give it often up the nose. And I can't tell you how many, not only does the vaccine not work very well, it actually causes symptoms of nasal discharge and kennel cough a lot of the times. But here's even more sinister. I've seen so many toy breeds over my career that after they get that intranasal Bordetella vaccine, they all of a sudden come down with collapsing tracheal coughs that last for a lifetime. So those airborne modified organisms that we're shooting up the nose, breathing in down the airways, are changing the anatomy of the trachea or altering the microbiome of that area and leading to chronic illness of the airways.
Wow.
And it's really a sad thing, and I've seen it over and over again. The other thing about Bordetella is that it's also a close relative of human whooping cough. So that if you vaccinate, like Bordetella pertussis is what whooping cough is. That's the organism. They're very closely related. And many of us, and this is talked about at our veterinary meetings, have seen immune compromised clients, clients who have autoimmune diseases, clients who are on chemo or have cancer, develop whooping cough like bronchitis from their dogs getting this intranasal vaccine, and then the dog sneezing all over. And of course, everyone in the room's getting inoculated at the same time.
Wow.
And that's also a documented immunological fact. It doesn't happen commonly,
Right.
but it shows you how easily these airborne organisms can be transferred when they're modified in laboratory form. But it's normal, to go back to your original question, to have these airway organisms there in low numbers. And it's the crowding and the stress and the poor hygiene sometimes, the stress with the diet, the anxiety, that's what leads to the overgrowth and potential symptoms. The vaccine doesn't do anything to prevent that.
Yeah.
If anything, it causes it or exacerbates it.
Yeah. Well, I could be a case study. My business could be a case study. So I don't require the Bordetella vaccine.
Right.
If people decide they want to get it, I make them wait 2 weeks. They can't come in. If they just got it, they have to wait 2 weeks to come in. I almost never have a Bordetella outbreak. In years will go by before I have a couple people will call me after a weekend. It's always a dog that's been vaccinated for it. It's always a dog who's a little stressed, little anxiety, poor diet, recently, vaccinated for it. It gets flea and tick medicated. It's always those dogs. And it's so hard for me to explain that to my clients because it makes it sound like because they want to blame the boarding facility. It's the boarding facility. They don't clean well enough. They're letting sick animals in. And when I explain to them about setting your pet up for success, especially if you're going into a boarding facility, you want to make sure before you go in there that your pet is eating healthy. He doesn't have, flea and tick stuff drenched on him right before he walks in the door. And a lot of people will do that. And, of course, eating these poor diets, I always go back to that. But
absolutely,
it is. Yeah. But you said things. I love doing this podcast. Like it's just the most favorite thing for me because I'm constantly learning and I just love to soak it in. I have never heard that the Bordetella is kind of already living in the body. That's so fascinating to me. They say that about cancer is that humans and people have cancer cells and then we feed them. And so it's making perfect sense to me that that is there. And then we create it and make it. Oh, that's so interesting. The other thing you said.
And in your business, by the way, a lot of these clients, they're going to the vet, they're getting the Bordetella, but then they're also getting parvo distemper, the modified live ones.
Yep.
And what Dr. Dodds talks about this for decades, 10 to 14 days after the modified live distemper parvo vaccine, you have an immune suppression.
Yep.
So you have the immune suppression phenomenon. They're boarding, they're stressed, they've gotten the vaccine up the nose. It's a recipe for a nightmare.
It is.
What were you going to say?
It is. had many conversations with Dr. Dodds about even, that's why I've become so outspoken about boarding facilities. As much as I love boarding dogs, and I will continue to do it the way I do, 99% of boarding facilities are telling you that it's the law, you have to have the Bordetella. It's a policy, not a law. First off,
Right.
it's their policy, it's not a law. I always
Right.
say every state is different for kennel licenses, but you need to find out what is required. But all the boarding facilities around me are constantly having kennel cough outbreaks, and I don't, and I'm the one who's saying stop giving it. So I really wish I could write policies for people and tell them how to do that. But you also said something, and then I'm going to ask you a question, but you also said something about the trachea. So our listeners know, you now know, I've worked with animals for so many years, and we didn't used to see a whole lot of collapsed trachea. It was very rare, very rare.
Right, right.
We also didn't used to have boarding facilities. They didn't exist.
Right.
You left them at your friends, or people left them at home. Since now I'm like, oh my gosh, you're a brilliant man, because that is the connection that I've been looking for. Why are all of these dogs getting collapsed tracheas? There's so many of them. And all of those dogs are constantly getting the Bordetella vaccine up their nose because they are staying in boarding facilities that didn't exist back when I was a vet tech.
Right.
That's what it is.
And you'll see, if you start to look at some of these, especially the toy breeds, you'll see that a lot of the Malteses and the Pomeranians, they develop a chronic cough after the Bordetella vaccine.
Yeah.
And it's later diagnosed as that pathology, collapsing trachea. Just to throw another deeper, little more metaphysical aspect to it, the Bordetella vaccinated animal, also, if they're an old enough animal, you can redirect the life force in terms of its illness tendencies to even develop mitral valve disease. And then they start to develop murmurs, and then they're coughing because of the mitral valve disease. So I've seen dogs that are vaccinated for Bordetella, didn't have a heart murmur before. All of a sudden, a few weeks, a month or two later, now they've got a loud murmur, they get worked up, and they have mitral valve disease and have to go on all the cardiac drugs. So when the bottom line point, Carrie, is when we put modified genetic, whatever you want to call them, vaccine organisms into a patient in an unnatural way, you can actually cause the whole body to go out of bounds, and it doesn't work in parts, and you can get systemic disease in areas as locally as the trachea, or in the heart, or in other areas of the body. That's really amazing.
It's so powerful what we're talking about right now to me, because I have an enormous amount of very heart problem dogs that I take care of, collapsing tracheas. And because of the length of time I've done this and how long you've been doing it, I've watched the shift from animals who didn't have these problems. We've got chronic disease, we've got autoimmune disease, we've got this enormous amount of stuff. And when you think about how much it goes back to these vaccines that aren't really have you ever seen a dog? I have never even seen a pet hospitalized with kennel cough. Have you ever seen anyone die from it? You have to get.
I've never seen anybody. No, it goes away with. It's annoying. It sounds terrible, right?
It's scary.
Right. Sounds like a croupy cough.
Yeah.
But I've never had one die. I mean, they get better with, traditional therapy. They get better with cough suppressants. They get better with homeopathy and holistic therapy.
Yeah. I've seen people just give honey for a couple of days.
Honey, right? Honey's a great one.
And
coconut oil.
Put a little honey in their water, and 2 days later they're calling me saying the dog's fine. So that's what bothers me the most about certain vaccinations, right? Because I've seen dogs die from parvo, so I understand the fear and why veterinarians would want to give a parvo vaccine. I can't understand Bordetella vaccines. I can't wrap my head around it.
Because it's even in every textbook it says it's a self-limiting disease in 10 to 14 days. You're right, and they don't die from it. And it goes back to any of these diseases too that have an autoimmune component.
Mm-hmm.
In other words, where when animals do get sick from them naturally, it's the body's immune response to the organism that causes the problem, i.e. feline coronavirus or FIP, i.e. Lyme disease, leptospirosis. These are all immune responses that lead to the symptoms we see in animals and in people. What they're talking about with COVID-19 now is antibody dependent, cytokine storms that come later on because our immune systems are reacting against these spike proteins. And then that's leading to other sequelae down the road, all autoimmune based. And we have a whole plethora of autoimmune diseases in veterinary medicine, from thyroid disease, Addison's disease, to
Cushing.
Cushing's, and a lot of these are vaccine autoimmune related.
Yeah.
It's just amazing.
This is something I'm just now starting to look into and research because I think there's a link, but do you think that I've been seeing a lot of nasal cancer?
Right.
You think that might be due to intranasal?
Yes, I've had 2 cases of that actually.
Yeah.
2 of them in the last few years.
Yeah, it's just been in the last couple years. I'm seeing
right.
more and more clients coming in with their pets have nasal cancer. And I brought it up to a couple of veterinarians. Oh, no. They say, oh, no.
Right.
And I'm like, well, I think it's something to be looked at. Hopefully somebody will do a study on it, but I absolutely feel like there's a correlation. I remember years and years ago when I linked the flea and tick medication to seizures, and I just became convinced that stuff was causing seizures, but I would talk about it and people would say I was crazy. And it's only actually been the last year that I'm starting to get people go, oh yeah, even though the FDA, right, told us, yeah, it doesn't.
Right, yeah.
Still get people that fight me on it. So I know in 10 years, someone's going to say, oh, the Bordetella nasal causes cancer.
And to go back to the core vaccines, you might as well call them the core puppy vaccines.
Right.
So what I mean by that is they're like the MMR shots of dogs and cats.
Right.
So they don't need these shots. If you believe in them, you decide to get 1 or 2 of them early on in life. You only need them that first year or 2. And I know we were going to touch briefly on the titer issue. And I don't care what the titer is. Year 1, year 2, year 3, year 4, year 5. Your dog, if he was adequately vaccinated for parvo at age 4 months of age, let's say, or you chose not to, hopefully, but if you were vaccinating him, that animal's not going to get parvo at age 4 or 5 or 6 or 7. So you don't need to vaccinate every 1 to 3 years. You don't need to spend the hundreds of dollars on these titers over and over again. And then, the titer is low, so I have to booster him. And that's not true either.
Yeah.
Because the titer is just one part of the immune system.
Right. Well, we talked about titers a little bit. We always do a little, for our listeners, we always do a little pre-conversation. And I know you and I had talked about probably the majority of veterinarians don't know how to read a titer. And so what ends up happening is I only recommend the titer to my clients, and I guess now to my listeners, if it would help them to feel a little better. Because a lot of times they're just scared to just stop the vaccines. And so then I'll say, if you're afraid to do that, then the next step would be you need to find someone to get a titer test. But then you need to find someone that knows how to read them. Because if you get the wrong veterinarian, now what will happen 9 times out of 10 is you're going to pay for the titer. And then they're going to say you have a low titer and not know, right? And then you're going to pay for the vaccine. So can you help our listeners understand a little bit about how someone could misread a titer test? And maybe just define titer test for us.
Well, the titer test is what it is it's a measure of what are called antibodies in the body. And it's one part of the immune system called the B cell part of the immune system. And it's antibodies that are produced that we measure. And we then have cutoff points to say that if this antibody level is above a certain minimum, that animal is protected against this infectious disease. And they base that on, what are called challenge studies and other studies. When an animal has any, this is what I don't even think you have to really interpret them that complicated. If an animal has any measurable titer at all, that's an indication of what we call immune memory. And that means that even if it's a low or even occasionally negative, as long as there's some indication of what is called immune memory, we have what are called T cells. I have to give a little immunology.
No, it's good.
T cells in our bodies that are more important for viral immunity anyway, that kick in and protect us against viral diseases. Again, they're called T cell memory cells. So the titer test, like you said, if it gives people peace of mind, that's fine. If you could use it as an alternative to getting your animal into a boarding facility or to, licensing them for rabies, certain states now allow rabies titers. But just to run them, to spend the money, really over the age of a few years of age, other than those reasons we just stated, you really don't need to do them. And I will simplify the interpretation, in my opinion, that if there's any positive titer whatsoever, even if it's below the ideal, that's good enough.
Yeah.
That's good enough.
Yeah. But when you run a titer, a veterinarian gets this range, right? And so
Right.
I haven't looked at a titer test in a while. What does that range look like? It'll say like 0 to.
Well, let's look at parvo. That parvo is called hemagglutination inhibition titer, HI test it's called. And they say that if and the numbers don't mean anything, just for the sake of our
Right.
discussion, they say that an animal should be considered to have a parvo booster if the titer is less than 1 to 80, 1 semicolon 80, colon 80. And that means that if he has a titer level that's less than that, at 40 or 20 or 10, that animal could be at risk of parvovirus. And what I'm trying to say is, no, they're not. If
Right.
they're positive, they have immune memory from T cells that are much more important with viral associated protection. And you don't have to be vaccinating your animals because they have a low titer. That's why I'm not a titer man anymore. And I think you and I discussed this before I came on. I've been measuring titers in veterinary practice for 30 years. So I go back probably longer than most in this country. Late 90s, my first boss out of vet school said, "Oh, we'll just make more money running titers." And when I came back from a vet meeting. And he was right, and we did vaccinate less animals. It was great. But I really observed and I've measured probably more titers than most in this country over that several decade period. And we never saw clinical parvo or distemper in any animal that had a positive titer
Yeah.
at all, any measurable titer.
Yeah.
So
What would cause the fluctuation in it? Like if I were to take my dog in and I don't know, on 1 year, I might get one reading, and then 2 years later, I might get another. Is that because maybe possibly an exposure to parvo that would
probably,
raise the levels?
yeah, re-exposure,
Yeah.
sure, or variations if it was close enough with values. Sometimes you'll get the way the tests run, they're dilutions as they run these tests. They're done in a petri dish, so you might get slight variation there. But the re-exposure routine, sure,
Right.
they're going to be exposed. I can't tell you how many animals I've seen where one animal gets vaccinated in the house. This is important for two reasons. A little puppy will get vaccinated, and then you have a 9 or 10-year-old dog that you don't want to vaccinate in the house because he's, let's say, got chronic disease or illness. Well, the young puppy gets vaccinated, but the older dog gets sick.
Yeah.
That's because the young puppy is shedding the modified live viruses around
Right.
him or her and affecting that other puppy, the other older dog. And that other older dog, we can document the antibody levels go up.
Wow.
So he or she wasn't even vaccinated. They were just exposed to the
Yeah.
vaccine. What makes you wonder about what's going on with COVID-19 now and everything that's happening.
Well, yeah, we have to talk about. I did question that myself. That's a whole nother topic we could talk about. But that is why if you are boarding your pet somewhere, you need that 2-week period. If you have a pet, let's take a diabetic dog, an older diabetic dog, goes to a boarding facility. He's under no stress. He's not getting vaccinated. He's all of the thing. He eats healthy. Everything's the perfect thing. And then someone else comes in with their puppy who just got the parvo vaccine, didn't wait any kind of period. According to Dr. Gene Dodds, parvo is the most shedding vaccine out there. And now you've just made your diabetic dog sick. So if you're boarding your pets, please make sure that they have a policy, and it's a strict policy, to at least wait 2 weeks. I go with 3 weeks. They're not. Let's talk a little bit. I know I don't want to keep you too long, but I really want to touch on this. So let's talk about the coronavirus. Not necessarily the pandemic that us humans are going through, but I have seen, and it is making me very upset, a huge increase in the number of dogs that are getting the coronavirus vaccine. Can you tell us a little bit about why that's a bad idea?
Well, because dogs, there's no real hard data that show that dogs are susceptible to human COVID-19. And there's, very little data that's transmitted between human and dog or human and cat or cat and human.
Yeah,
So, it's just, to me, it's all based on fear. And with our animals, with coronaviruses in general, I like to give a quick editorial. Not one coronavirus vaccine has ever been shown to be safe or effective in any animal species up until Operation Warp Speed, which is soon to be determined,
right.
because we are the experiment, and with our cats, that's a perfect model. When we vaccinated them for coronavirus, the cats got sicker on exposure or died. And all of these viruses are very similar, but they're not identical, but they're very similar. But back to your original question, no, there's no real, you know, viable data that shows that there's transmission between dogs and people and people.
Well, it's interesting to me too, like leptospirosis, we know there's tons of different strains of it, and then people will go get this
Right.
vaccine that isn't even going to cover the strain that is in your area. And so we're learning, this has been a good thing that people are learning about vaccinations and how it takes 2 weeks to build antibodies and all of this stuff. But there are different strains. And so the coronavirus vaccine for dogs isn't the strain that
No,
people are getting. So that's and the symptoms actually what are the symptoms of corona in dogs?
basically mild digestive upset, diarrhea, maybe some vomiting. Um, Also, and in cats, it can be a little more serious. The cat disease mimics more COVID-19, to be honest with you. And that's a whole other discussion we could do for another time. But with dogs, it's maybe mild diarrhea or vomiting. The other thing you have to keep in mind, and this is so important, because this type of test is done in both human and animal medicine. It's being done right now with COVID-19. It's driving the pandemic, literally. And that's this PCR test. This PCR test that's being, hung across the media and used in veterinary medicine as well as gospel was never intended to be a diagnostic test by its founder, the guy who won a Nobel Prize on it. Kari Mullick's his name was. And he ironically passed away a few months before the first cases of COVID-19. But if he was alive today, he'd be on the TV. This whole thing probably would have, been over by now, because it's his test. He's been saying that, he's said for decades, this is not a diagnostic test. There's too many false positives, negatives, too much variation. So we also have to be very careful what we're calling a positive test and a negative test.
Right, right.
And I just wanted to add that.
No, I'm glad you did. But I have been seeing these dogs coming in with all these corona, and veterinarians kind of moved, even conventional veterinarians have kind of moved away from the corona vaccine for years. I would just see
Right,
distemper, parvo, rabies, bordetella,
right,
leptospirosis.
right.
And now, boom. And I know that the way that they're communicating with their clients is in a fear-based way, because the clients are coming to me saying he even got his coronavirus vaccine. And I'm like, oh,
Wow. I didn't know that that was making a comeback.
it's making a comeback. Absolutely.
Wow.
And I'm like, now we're adding one more vaccine into the pot for fear of something that isn't even the same strain. And it's heartbreaking. So,
And it's also just like with kids and most people, 90 some odd percent of dogs who are exposed to canine coronavirus get minimal symptoms at all and get over it on their own.
yeah,
So, when you look at why are we vaccinating certain populations when 98 to 99%, remember we heard that with COVID in the beginning of the pandemic, 98 to 99% of people are getting the sniffles or a cold. Why are we going crazy on this whole thing? And we don't do that for the flu, the human flu.
yeah.
So it's when it comes to vaccines, Carrie, in a good summary, none of it makes sense because science goes out the window and profit, greed, and fear really step in. And it's no different in our profession either. And I think if we could summarize all of it, that would be it.
So I think
fear, profit, and greed.
no, I think that's the best way to summarize it, and because we're coming up on an hour here. We're over an hour, which we could talk
Right,
forever. I could talk forever
right,
about
right.
this stuff, and hope
Yeah, I
back
know.
on the show and we'll do that. But I want our listeners to know that even though you're in Florida, they can reach out to you. So you're a huge resource for our listeners. But how would they get a hold of you?
Well, they can go to my website, which is Dr. Dym, spelled out. That's DoctorDym.com, and that has my contact information, my email, and my practice phone number.
And you can do a lot, right? They don't have to be in your office. So how would that look
No,
for them?
I do. Much of my practice is done by telemedicine. I have plenty of clients all over the country. And homeopathy, for those of the clients that are familiar with homeopathy, we really don't have to have the patient in our office because we're prescribing based upon the symptoms of the patient, what the discharges look like, what the symptoms look like, and the owners, the guardians describe that to us. I mean, I love to see my patients. I get a whole other feel when they're in my office. But we can work with people by telemedicine, and some of my best cures in homeopathy have come through the telemedicine, land. So
In some ways, it almost seems like it could be more, I don't want to say more beneficial, but sometimes the emotions that when someone's in the office with you could play the pet being acting a certain way in front of you that he wouldn't act if he was at home and you're seeing
that's true. That's a good
and
point.
some
That's an excellent point.
doing this way may actually be more of a benefit than doing it in the
And
office.
yeah, and sometimes the animal will distract the guardian for giving me the information I
Yeah,
need, and so rather than either directly engaging the client or doing it even by Zoom,
yeah,
it's easier for me when I'm listening and I'm taking notes and they're describing the lesions and they can send me pictures of the ear
yeah,
or they can send me pictures of the various parts of the body. So,
yeah.
I'm able to do quite an efficient job with homeopathy just through the
I
telephone.
bet. I do. I really think, like, I think about just people, their day-to-day lives, you're stuck in traffic, you're mad, you've got all this stuff, you're trying to get to the veterinarian, they walk into your office and their energy creates a different
Right.
energy. And with homeopathy,
Absolutely.
energy is so important for us to be able to see. So I could see the benefits of doing it through this.
Right.
So,
Right.
and I'm excited. I know that our listeners will be able to reach out to somebody. A lot of people that call me and talk to me, they're in rural areas where they don't even have a veterinarian at all. They have to drive miles and miles to get to one.
Right.
So you're going to be a valuable resource.
Well, thank you, Carrie. Thank you. It's been a great hour too.
Yeah, yeah.
It really flew by.
No,
You
you're
know,
you're so great at what you do. Can you just give like one quick little piece of advice to our listeners before we head off of here?
my best piece of advice would be to look for healers, look for veterinarians that are the true sense of the word doctor. And the word doctor means teacher. And a good teacher gives their guardians and their patients, their clients, information to make an informed decision on their own. In other words, when you hear things that you or I have to say or other doctors, that's all great. And obviously we're very passionate about it. But each client needs to also understand that ultimately the decision on how they care for their animals comes down to them. And hopefully they'll see a good doctor or a good teacher that will give them all of the information they need to make informed decisions on their animals, whether it's to be a holistic client, hopefully have to go integrated on some cases, or even when Western medicine has its place.
Yeah,
So that's my take home message to them.
that's an amazing message. It really is, and it really kind of nails who I think you are. And I love speaking with you. So I
Good.
just want to thank you so much for being here.
I really enjoyed it.
Yeah, it's awesome.
Thank you.
To our
Looking
listeners,
forward to seeing it.
huh?
I look forward to being on here.
Oh yeah, we've got so much we can do and share. I will do this for days. To our listeners,
Right.
thank you all so much for tuning in and listening. Please remember to like this, share this wherever you can. It's important information. And as you all know, I don't do commercials. I'm just here to educate you. So you can feel comfortable and confident in sharing this with your friends, that we're not going to bombard them with sales pitches and all that kind of stuff. So we're just here. The people that I bring on the show are just so amazingly passionate about healing your pets. And so I hope you'll take the opportunity, if you're struggling a little bit, to reach out to Dr. Dym. He donated his time here today, and he would be just a valuable resource for you to put into your repertoire of veterinarians that you can contact. You can find all of his information will be on our show notes, so you'll be able to contact him. It'll be on there. And I just hope you guys just find this valuable and continue to keep listening. Thank you.
Thank you.
All right, so Lori will cut it right there, but I do really, that was
Great.
that was really great. That was really,
Yeah, I enjoyed it. We had a nice talk.
yeah, you too. Enjoy your day.
Flow.
I will, reach out to you, and I'll start sending you some more clients and stuff.
No, that's great. Whatever. Yeah, let me know when it's on so I can.
Yeah, so how it'll work is
Mhm.
this will air. We already have you in the lineup because we're done with season 7. This is season 7. So I think your
Right.
4th or 5th, Lori would know better. As soon as I
Okay.
know the date, we'll send it to you. It'll air on the audio on a Tuesday. Then video
Okay.
goes out on Thursday. And then if you want, I do a live Q&A that weekend. So anybody that listened to it could come on and ask you questions.
Absolutely. That would be great.
Perfect.
Yeah,
Perfect. Yeah, as soon as I get the actual dates, Lori and I will reach out to you and give you all that information.
Do you think what, several weeks? Or?
Yeah, it'll be, we still have to edit, cut, do some things. So
Right.
the first episode for season 7, I think, airs in 2 weeks, and then it's every Tuesday from there. So yours is probably about 5 weeks, 6 weeks out.
All right.
Okay.
Just so I have a rough idea. Great.
Yeah.
All right, Carrie, I really enjoyed it.
Yeah, me too.
Thank you for having me on.
Yeah, thank you. Have a good day.
It. You too, sweetie.
Bye.
Bye-bye.